Join me and Dr. Brett as we take John through a performance physical therapy session.
I just want to talk about some of the things that we've been working on. How are you feeling with prolonged periods of standing? Is that something that you feel is getting better? Something that is improving?
I think it is.
That's awesome. Have you been having any night pain or nighttime discomfort?
No.
Okay, great.
Just a little bit of that. It's like a cramping up of the muscle on that right side.
Okay. Is that right kind of like gluteal area?
Yeah, and again, it's, I feel like we're making progress because historically all my pain is on the left.
Mm-hmm.
And so it's shifted to the right now. So it's like we're doing something.
Yeah, your right hip is learning how to help stabilize and actually help keep up with that left side instead of your left side being such an overachiever. And so you're going to feel some of those muscle soreness changes that are going to happen through that process.
Thanks.
Hannah, could you grab the handheld dynamometer and put the curved pad on it, please? We're going to start with some hip extension strength and then hip internal and external rotation. Okay. Strength, extension, prone position, long lever, left side to start. Keep the toes slightly pointed. I'm going to press the device here against your leg. Keep the leg extended and lift the leg up towards the ceiling and test on either side.
Do you want me to bend at the knee or bend at the hip?
Bend at the hip.
Okay.
And go. Push, 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 push. Relax. Good. Any back pain?
No.
Okay, great. Now switch sides. Go. And relax. Any back pain?
No.
Okay, great. So with the testing there, we're nearly identical. Having some asymmetries is not a bad thing. It just depends on whether or not it's indicative of any sort of issue that we're currently dealing with. All right, now we're going to do external and internal range of motion at the hip. So we're going to bring the leg up to here. I'm going to bring this along the ankle. Now I want you to rotate. I'm going to take you through the motion first, and then you're going to do it yourself.
Okay.
So I want you to rotate this way as far as you can with your hips staying, the front of your hips staying on the table.
Okay.
Okay, go ahead and try to rotate. There we go. And relax. Now for this next one, we're going to externally rotate. So now we're going to rotate this way as far as we can without this hip rolling off of the table.
Okay.
Go ahead. There we go. And back. Good. I'm going to bring this leg down. Go ahead. There we go. Good. Bring it back. Okay. Now we're going to go this way. When I give you the go ahead. Go ahead. Okay. And do a strength test for internal rotation. And so leg's going to be bent, and then your goal is to push out this way, and then I'm going to resist. Okay. Go ahead. Push. Relax. Good. Push. Relax. Good. Nice job. So we'll work to try to keep that knee down. Okay. Get you in resting position first. Push. Relax. Okay. Good. And push. And relax. Good. Any pain with either of those movements?
No.
Okay. So we can see that the left side is max force of 20 pounds, right side is a max force of 19 pounds. So we're still nearly identical, which is great. Being able to work on creating that internal rotation strength, because if your hips have internal rotation, your low back does not have to make up for a lack of it. Make sense?
Yeah.
All right, cool. All right. With the adductor whip, your adductor muscles, which are the muscles that run along the inside of your thigh next to your hamstrings, those muscles also work as hip extenders. So if you have a little bit of an adductor whip, that will create that knee valgus, or that inward crashing of the knees when you're coming out of the bottom of the squat, because your hips are trying to create hip extension immediately as you come up from the bottom of the squat. Otherwise, you wouldn't stand all the way up. And so when that happens, it's a normal thing to happen. But if you're getting back pain or hip pain or knee pain in the bottom of the squat, then that's something that we would want to take a little bit of a closer look at. But if you're not having any issues with your squat, you're not having any performance reductions, and you're not having any symptoms associated with it, then it's not something that I would necessarily address right away. But something I would look into addressing if I needed to. Especially for like high performing Olympic lifters. We don't want to unteach that technique because we could mess with how their body is trying to establish that position, and we don't want to take away from the strength that they've already built with their technique to get to that point, because that adductor whip is kind of a reflex, so to speak. Two, three, for 61.
Dude, that video haunts me. Doing those squats. That's not good.
7, 8, 9, 10. Good. Step in a little bit. This leg, so the face is up. That leg comes in. That way we can minimize the feet wide. Bring your step. There you go. Here we go. 2, 3, 4, 5, 6, 7. Hold the time. Okay, get our timer ready. We're going 45 seconds, alternating marches. I want your feet close enough that you can kind of shift your weight a little bit, but not too close. You're going to bang your knee on the inside. You have a little bit of a wider hip. And go. There we go. Good. 45 seconds. This first hit, keep the warm up. Getting a lot of that alternating hip extension. Really working glute med. 15 seconds in. 20 seconds left. 5, 10. Good. There you go. Good. Definitely load this up.
Form looks good.